so we are very well prepared for situations such as coronavirus. We've been doing this for many years. We have committees and teams. We meet monthly. We work with the state. Issues such as things in the past like H1N1, Ebola, we're prepared. We have resources, staff resources, equipment, and in rare instances we have to utilize a tent, which is what we are doing today. The tent that we are utilizing today is for, it's a drill. So we are preparing ourselves for, in the event that we were to utilize the tent, we make sure that it functions, it has heat, it has air conditioning, utilities, everything that we would need to do to function out there. We'll test that for 24 hours, and then once we determine everything works and everything's at our levels, we'll take it back down.
So the purpose of the tent initially is, as Dr. Perla had stated, to ensure that it actually is going to be able to work. Long term, we may be able to use this for testing. We may be able to use this as a triage area. At this point, it's a fluid situation, but we haven't entirely decided exactly what we would do with it in the event that this becomes a local epidemic. So in terms of testing, we can swab patients, but the state determines whether or not a patient will be tested. This is not dependent upon the physician or location. In terms of the current criteria for testing, there are 3 criteria. The first one is that you have fever and cough and have had a interaction or close encounter with someone who is positive for the coronavirus or COVID-19. The second is that you have a fever and a cough and are coming from an area where it is highly prevalent, like Italy, South Korea, or Japan, or China, or Iran at this point. And then the third is that you have ARDS, which is adult respiratory distress syndrome, and don't have an otherwise known or found cause. The testing process involves using 2 swabs, one that goes up the nose and one that goes in the mouth. We then seal those tests, and then they're transported to the DPH, where the DPH decides to test. There are times where we will send and they will decide not to test. This is entirely out of our control at this time. You know, if we end up getting a patient who comes in displaying symptoms with the appropriate or concerning exposures, then the first thing we would do is ensure that we put a mask on that patient. Then we are going to bring them back to a negative pressure room where we are able to appropriately exhaust the that specific room so that we don't continue to have virions in that location. We will protect ourselves with personal protective equipment so that we don't end up getting infected as well. Going from there, we'll do the standard medical evaluation and get in touch with the DPH, potentially send and test for this disease, but as I said before, it would be on the discretion of the DPH. And then we'll determine whether the patient needs to be admitted to the hospital or not. But under no circumstances will we be afraid or unwilling to take care of a patient who exhibits these symptoms.
We're utilizing the CDC guidelines for face shields, masks underneath, gowns, gloves, and we have great processes for sterilizing the rooms afterwards and all the equipment, so we're in great shape. What we want the public to know is that Norwood Hospital is very committed to providing healthcare to our community, whether it's for the coronavirus or whatever it may be. We're in great shape to take care of the community. We have amazing doctors, nurses, and support staff, and we're here to make sure that if things do happen to evolve, we're going to be here. We're going to make sure that everyone gets the best care possible in a safe manner.